Local doctor says he's invented new technology that's helping women of color reverse the signs of aging.
Oh, Jen, tell me more.
Okay, so you know our friend Dr. Eric Bernstein. Good morning.
Hey, how are you?
Okay, so everyone knows you're like kind of a laser nerd.
Yes.
And basically you created this technology treatment because in years past, people of color, it was just really contraindicated to work with lasers on their skin.
Well, yeah, it's challenging for sure, but we created this kind of for everybody, and what we learned, because of the technology, because of the small spot and all this cool stuff, it works on all skin types.
Okay, so what are we
it's
about
really
to do?
for everybody. So we're about to start treating her, and you can see from this cool square where the laser's going to go. Now watch, when I step on the foot pedal, you see it kind of go, and you see it makes little tiny dots, which is called fractionated, meaning it treats just a fraction of the skin, leaves some normal skin in between. Look how fast it is. And you can see it's not even bothering her.
She's not even flinching.
No numbing cream, no nothing. It's really, and the reason it's not uncomfortable is the same reason it works so well.
Okay.
Right? It's this technology that it's a fiber laser. So
what did you do to make it so that, I mean, you know, people with really pale skin can use a lot of this stuff. What makes this different for people with darker skin types?
So what's different about this is a few things, right? It's the way the energy's laid down. It's called a cold laser, and I wouldn't say it's cold. It's just not hot.
Okay.
And that's because the energy goes into kind of vaporizing the little superficial portion of the skin and doesn't go into depositing heat in the skin.
So
that's why it doesn't hurt.
What was the, so it doesn't hurt?
No.
Okay. Does it hurt? Because you don't have...
She'll tell you.
It does not hurt?
You can talk.
She's not even flinching.
No.
Not at all.
Not at all.
It really doesn't hurt. So we did a study with this setting. And by the way, the guy that invented this from the beginning, a really brilliant guy, he said, what are you doing this treatment for? It's superficial. No one's going to want it. We did a study in 20 plus patients. It works so well. There's now a button on the new software that calls this the 3D miracle. And so one of the nice things of working with friends who are honest and there's a lot of feedback is that, you know, they listen to what we have to say. Because ultimately it's the doctors using the device that know what it needs to do, and the physicists and engineers that build it that kind of put together the pieces in a way that we want. And so what this will do, it'll improve pigment, fine lines, all the stuff we hate about our skin, and it's very versatile. You can also use it to treat deep wrinkles, acne scarring, and in a study I'm doing now, doing those treatments, we also don't use any numbing cream.
So, and what's she going to look like tomorrow? Like, she looks good today.
She's going to look good tomorrow. She'll be a little bit pink.
Okay.
She's going to be beautiful. Her skin's going to look, I mean, look, she's already so beautiful, right?
Yeah.
She doesn't really, but, you know, she'll get some increased evenness of skin tone, some improvement in the texture, and it makes the topicals work better, too.
So, like, all the fancy skin creams will go in better?
All the fancy skin creams will go in better, yes.
Okay, so basically this was a thing, you made it better, and now you made it so much better that there's a button, but they're calling it the 3D thing, they're not calling it like the Dr. Bernstein button?
You know, I suggest that. No, I would never suggest that, but yeah, no,
but it's okay if I do?
No Bernie button, yeah.
But seriously, she's not flinching, there's no numbing cream.
No. And it really is a function of the physics of the device. Like this is, you know, every so often there's something new. When I first started,
not hot or anything.
When I first started, she'll get a little bit pink afterwards.
Okay.
And what's cool about that, if you look under the microscope, where this affects the skin is in kind of the superficial, almost dead skin layer. But if she gets pink, that means the laser's affecting the deeper layers.
Okay.
So that's the best case scenario, right? Injuring the part you don't really care about a little bit, but creating inflammation and change, positive, good change in the deeper part.
Here's all I have to say. It's 2020. Why are you saying please, Mike?
I want it, and I want it now.
I have questions, Jen.
Okay, Alex has questions. Go for it.
How many treatments do you have to have in order to see results?
Yes.
How many treatments do you need to have results?
Well, first of all, you'll get results from one, but typically we do 3 treatments at like 1 to 2 month intervals.
Okay. So did you hear him? Sorry with the mask.
And what does he call this treatment?
Sorry.
Like, what's the name of the laser?
Got to do to me.
What's the name of the laser?
The UltraClear.
The UltraClear. And what's the name of the treatment?
Name of this treatment is called 3D Miracle, but there's other things we do with this laser,
Yeah.
right? We use it for acne scarring, wrinkles, etc.
Oh, Lord.
Bottom line.
And how expensive is it?
I didn't come up with that name, but I
Now,
like the name.
You know the next question.
Now,
How much?
you know, it depends on where you're treating and how much. It can be from $400 up, depending on what you're doing.
That's fair. That's fair.
I need a whole body thing.
$200 for a facial.
50,000.
Oh, you need the whole. Mike Jarrett
My
needs the whole body.
my
Can you
entire
zap his whole body?
The man's perfect, but yes, we can zap his whole body, no problem.
Don't lie to Mike.
Seriously.
There's no lie.
Very
Here's the
interesting.
thing. The bottom line is this.
Yeah.
I love that it's something that everyone has access to. In
Yeah,
the past, there's
yeah.
been so many rules about this person, that person. Everyone wants to look better. No one wants to pay $10,000.
No.
Thank you.
Do I
And
have to
thank
be a
you.
woman of color?
Thank you.
We're gonna finish her
No,
up.
you
would be
can
a
do
gentleman.
everything. You can do. It works on light-skinned dudes too.
No,
Of
okay.
course.
Yeah.
We're the easiest to treat,
Sometimes I feel like a woman of
and
color.
we're also the.
Is that
But he
close
makes a
enough?
very good point because a lot of times they say with laser and laser hair removal and all that, like be careful if you have more melanin in your skin.
True.
Because it could have lasting effects. So